Good afternoon and welcome. Appreciate you carving time out of your day to join us. This webinar is one of a series of monthly webinars focused on bringing information of a practical nature to those living with ALS. Given the frequency of questions related to genetic testing and genetic counseling we receive, we are pleased to share information today about genetic counseling in the ALS community. For your convenience, the webinar and the associated slide deck are recorded and posted to the ALS Association website for post-live presentation viewing. Before I introduce our guest speaker, let me invite you to participate in our webinar by posting comments or questions to the question box. I may be able to answer your question privately if it is of a technical nature, or I can share your question or comment with our audience during the Q&A session. Because we continuously strive to share information that you find practical and valuable, we're inviting you to complete a brief 3-question survey that will appear on your screen immediately following the webinar. All responses will be submitted anonymously unless you include your name or email address in your response. So let me introduce today's speaker. Donna Bernstein is Associate Director of Genomics in Clinical Development at Ionis Pharmaceuticals. Prior to her work at Ionis, Donna spent decades in genetic research, testing, and clinical disease management. She's authored a number of peer-reviewed articles and is a member of the National Society of Genetic Counselors, the Neurogenic Special Interest Group, and the ALS and FTD workgroup committees. Please join me with a warm welcome for Ms. Bernstein. Ms. Donna, you are on the, thank you for sharing your slides.
Okay, hi, everyone. I'm really happy to be here today. I'm Donna Bernstein. I am a genetic counselor, and I'm happy to talk to you today about genetic counseling for ALS and a little bit about genetic testing for ALS. I'm going to try to focus mostly on the counseling more than the genetic testing or the science and the genetics of ALS, but I will talk about that a little bit too, just so that the counseling also makes sense. And with no further ado, I'm going to start by explaining a little bit about what is genetic counseling and what is it all about, who are genetic counselors, what do we do, and then specifically about ALS genetic testing and what we can learn from it and why we might want to find out more about the genetics of ALS. And I am also going to describe our sponsored genetic testing and genetic counseling programs. I should have added that. There wasn't enough room in the box, but our genetic testing program also includes sponsored genetic counseling. And then thinking about, well, who is appropriate to have genetic counseling? What is the right timing for this? And are there any considerations to think about prior to having genetic counseling? So what is a genetic counselor? Do we teach, are we counselors at summer camps for people with genetic conditions? Not exactly, but we do volunteer in summer camps sometimes. And but no, that's not the kind of counseling that we do. Genetic counselors are often certified by the American Board of Genetic Counseling, in which case we have to have a graduate degree in human genetics from an accredited program, and we pass a board exam to be certified. And many states have licensure to practice genetic counseling. We often work in hospitals or medical offices and see patients on a clinical basis. And some genetic counselors work in a genetic testing lab and help interpret the actual genetic testing results for the lab. And some work in a biopharma company. And more recently, genetic counselors can often offer genetic counseling via video call or telemedicine. So this has changed. This has become much more common ever since the COVID pandemic. And genetic counselors are specialized. So some genetic counselors do prenatal genetic counseling, some are cancer genetic counselors or work in pediatrics or cardiovascular disease. There are about 250 genetic counselors who specialize in neurogenetics, and 50 are on this National Society of Genetic Counseling ALS and frontotemporal dementia working group committee. And there are 50 of them who are really truly dedicated experts in ALS and FTD. And I mentioned ALS and frontotemporal dementia together because some of the genes that predispose to ALS also can have a risk of frontotemporal dementia. So sometimes we talk about both of these conditions together. So genetic counselors do research, we publish, and these are just a few examples of some of the publications from some of my colleagues but there are many peer-reviewed journal articles that are published by genetic counselors on ALS and other genetic conditions. So do genetic counselors practice gene therapy? Well, not exactly in this sense anyway, but some genetic counselors work on gene therapy clinical trials or for companies that are developing gene therapies, but more like the psychotherapy, genetic counselors are trained often in Rogerian therapy or family counseling or grief counseling, and are trained at giving difficult news, which is something that that we often have to do. So I mentioned some of the different kinds of genetic counselors. So if you're looking for genetic counseling for ALS, you wouldn't go to a cancer genetic counselor or a prenatal genetic counselor. But what we all have in common, we have a lot in common, and we really act as a bridge between the molecular genetic testing lab and the physician and the patient, because we speak the language of molecular genetics, and some physicians really don't think about they're not trained in the terminology that we use in a molecular setting. And then we also speak what I call medicalese, so that we understand the medical nomenclature, and we hopefully communicate this effectively to the patient if we're doing a good job. So part of what we want to do is really get an idea of the best way to communicate. I think of genetic counselors as communicators of complicated scientific information and trying to make it understandable and usable for people, whatever their education or background might be. And again, we have to do all of our pre-med just same as people who are going to medical school, but we really just specialize in human genetics. We also have a code of ethics that's very important to genetic counselors. And a lot of this is really about putting the patient's perspective first. So when we do genetic counseling, we want to think about how does the patient specifically experience the genetic information in terms of making decisions that are right for their values, their culture, their background, and not inflicting our own biases that we all have or cultural experiences onto the patient. So that's sort of part of what we mean when we talk about non-directive genetic counseling. And that's very important because there are lots of reasons to have genetic testing or to not have genetic testing. And it's important to make sure that we're thinking about this from the patient's perspective so that they make the best decision possible with the information that's available at the time. The non-directiveness is mostly when there's no treatment or intervention available, but for if there's something that can be really life-saving or have a different management, that's when we become a bit more directive. And, for example, if early detection can be really life-saving for cancer, and we know that genetic testing can help us know what organ systems to look at so that cancers can be detected very, very early instead of late, that's when we say, no, genetic testing is a very good idea. But if it's something that there's not much that you can do, or if it's about decisions around pregnancy or family planning, that's when really the non-directive counseling is appropriate. So part of what genetic counselors do also is determine what's the right test to order for genetic testing and sometimes biochemical testing, and then to interpret those results. And we look up the genetic variant and do literature reviews and try to learn everything that's known about a patient's variant so that we're really communicating the most information that's available at the time. Because sometimes the change in the gene can really determine the right monitoring and medical management and sometimes treatment for a genetic condition. And then again, we all are trained at giving the results and explaining the genetic test results. And also we write a follow-up letter, and we write a letter for the physician as well as to the patient. And this can sometimes be helpful for the patient to show to other physicians or to other family members to help explain. And I'll talk about all of these things a little bit more in detail. And we also talk about, obviously, the implications for family members. So who should have genetic counseling for ALS? You know, I don't like the word should, but I think that sometimes it's appropriate and sometimes it's not. But there are two different kinds of genetic testing for ALS. And the answer is it's an individualized decision, like many decisions in genetics. So there's diagnostic genetic testing and genetic counseling, and then there's predictive genetic testing and genetic counseling. So diagnostic genetic testing is for anybody who has ALS or who's suspected of having ALS, and they want to have an explanation. Why does this happen? And there might be an explanation in the genes. There might not be an explanation in the genes, but if there is something that's detected, that can be informative. So when you have genetic testing, no test really will be able to tell you definitively, yes, this is not genetic. But if it is genetic, the testing can be very helpful to know. And sometimes we can learn more about what to expect from the genetic information about the course of the ALS. And so this is appropriate to be offered to anybody who has ALS, even if there's no family history, because many people can have a genetic kind of ALS with no family history. And again, I say it's appropriate to offer it, and then it's really up to the patient to decide, is this something that they want to know or not, and why. And then for predictive genetic counseling and genetic testing, this is describing when there's a family member who has ALS and maybe even knows that it's genetic. And in that case, other family members might be at risk, and they want to know if they have that same gene that predisposes for ALS in their family or not. And that is a more complicated genetic counseling session, because these are people who don't have any signs or symptoms, but they want to find out if they will one day in the future. And this is usually offered for any adult or family member, any adult who has a family member diagnosed with ALS, who wants to learn and wants the information. And there's a lot that goes into weighing these decisions. I said the predictive testing is for adults, because most of the time we don't offer adult onset genetic testing, or for genetic testing for adult onset conditions to minors. Genetic counseling is for anybody, but the genetic testing, usually for children, we don't like to offer genetic testing for something that won't occur until later in life, because children might not be advanced enough to really understand whether or not this is a good decision. And we don't want to take away their choice later when they're an adult to not know. If they choose not to know this information for predictive, there are exceptions to every rule. So these are sort of things that there's been a lot of research and thoughtful people have written about, but really there is also a need for flexibility and to take things into consideration on a case-by-case basis. For example, if somebody's an emancipated minor, or they're worried about a pregnancy and they're not 18, or for some conditions with ALS, there can be a young age of onset. I'm at Ionis Pharmaceuticals, and we have a clinical trial for ALS caused by a gene called FUS, and that can have a late onset presentation, or it can have an early onset presentation in the teens, or early teens or 20s. And so for something like FUS ALS, if that's in the family and there's somebody who's at that age where it could have onset, then the reason that you might make an exception about testing earlier is because it has such a rapid progression that you don't want to have to wait, because sometimes it can take a long time to get an appointment with a genetic counselor. Sometimes it can take time even to decide to go to the doctor, to get to the genetic counselor, then to order the test and to get the results. And if months go by, that could be way too long once there's already onset. So there are exceptions to every rule, but these are really the guiding principles. So what happens in a genetic counseling session? There's a lot of questions and answers and active listening on the part of the genetic counselor to kind of help the patient think through all of the things that might be helpful to decide whether or not genetic testing is a good idea at this time. So we might ask you, what brought you to seek genetic counseling? What information are you hoping to learn? What brought you to medical attention? What were the signs and symptoms? And what are you hoping to find out? What would you not want to know about, in case we could learn other things about you besides ALS? So sometimes people find out that their family isn't exactly the way they had always known it to be. There's sometimes non-paternity, or sometimes people were adopted. So, and again, that requires genetic testing by more than one family member usually, but it's important that people sort of think about all the things we might learn and what might want to know or not want to know, depending on what kind of genetic testing you're having and your family dynamics. And then how do you want to learn about your results, whether they're positive or negative? And if you do decide to have testing, and then how will it make you feel? I think it's very difficult to know how you're going to feel when you get this information until you actually receive the information. But to try to prepare as much as possible. So if the results are positive, are you going to feel the same way towards the people who are carriers in your family if they know? If the results are negative, how will that make you feel? And it doesn't always make it makes you feel relieved, but not there can be more complicated emotional responses to a genetic test as well. And then who would you tell if you have a genetic variant for ALS? Would you tell everybody in your family? Would you tell a few people? And then how do you think they'll respond? So these are things that you talk about with a genetic counselor. And again, as you can see, these are very individualized and personal. So it's not, there's no rules or right or wrong about it. It's just really to explore these things in advance to help prepare for learning this information. So genetic counselors will want to get to know you better. We would like to review medical records, laboratory records, imaging, pathology results, because that can be informative in case there's actually another condition in addition to ALS in that you might have, or a condition, or maybe there's something that is very similar to ALS but has different genes and isn't technically causing ALS. It's another kind of motor neuron condition or causing muscle weakness that a genetic counselor might be able to learn about. So we take in-depth medical history, review the charts, take a family history, and we look at the family history to learn about inheritance patterns and symptoms that can be passed from one family member. There's different symptoms that can travel in a family together, and not each family member might have all of the symptoms, but they can really give us information about what conditions we might want to be testing for. And if something is dominant, that means, so we have 2 copies of every gene, and if it's dominant, that means that one non-working copy is enough to have the condition. And most forms of ALS are dominant. And I'm not going to get too much into this because that's something that they do go into detail in a genetic counseling session. But there are some other kinds of ALS where you have to have 2 non-working copies to have the condition. Or even there's an X-linked. And when we do these funny diagrams, I can just tell you that the circles represent females and the squares are the males, and these are the different generations. And we look at who's affected and who's a carrier in these inheritance patterns, we can learn what the genes are likely to be also. So it's just more information. And genetic counselors will explain to you about the science of genetics. So, and this is what we call the central dogma, just how DNA it's the instructions for making proteins, or the genes are made of DNA, and they tell the protein making machinery what order to put the parts of the proteins in. Those are called amino acids, and then how the DNA and the proteins and changes in that can impact your health. So that's sort of the science part of it. And then once we learn about that, and we talk to individuals and understand what they're looking for, their family history, their background, then that helps us decide which test is the best one to order, because there are so many different kinds of genetic tests, and these are just a few of them. There are many, many more, depending on the kind of variant that we're looking for, where it is in the genome. Is it in the coding region or the non-coding region? And for example, if there's a family variant that we know a relative has already been diagnosed with ALS that's genetic, and we know exactly which gene and where to look, we might only want to test for that variant. Or that patient might say, well, what if I have more than one ALS gene? And that can happen. You can have more than one variant that causes ALS. So even if there is a familial variant, some people might want to say, no, I want to know everything about my risk for ALS, and whatever we can learn. And whereas other people might say, well, this will give us a certain answer. I don't have what's in the family, and that's all I want to know. And then most of the time we look at 33 genes that are on an ALS panel. So, and this genetic testing can be complicated because sometimes there's change in there's a gene that, depending on where the change in the gene is, it can cause a different outcome. You can have early onset or late onset in the same family, even with the same variant, but sometimes we know exactly what it means. So that's why there's some room for interpretation. And this is also why it's important for the genetic counselor to be able to see any genetic testing results that were already done in the family. So again, if there's no known genetic change in the family already, we can look at these 33 genes, or if somebody's sure they have ALS or something that is very similar to ALS and there's no variant that's found, then there's additional testing that can be done in these 33 genes, or even in other genes. You can look at all of the genes in the genome as well, depending on the circumstance. So again, it's going to be individualized. It's going to depend on the clinical presentation. It's going to depend on the family history, and the genetic counselors will get all of that information necessary to make sure that the best testing options are available. So what if you're not sure if you want to have genetic testing? That's fine, because genetic counseling doesn't require genetic testing. You can go to the genetic counseling session and talk through all of the information, and then decide, do I want to know this or not? And genetic counselors will help weigh the benefits and the limitations, which really is around the fact that no one test can test every kind of genetic change. Even if you do the whole genome testing, there's still limitations that not everything will show up in these test results. And then the possible risks of genetic testing, and the risks can be emotional. Some people can have anxiety or depression. Usually it's transient, but it's something to think about. The risks are more of a consideration for patients who are pre-symptomatic, who don't have ALS, but they want to know their genetic status if they're at risk for ALS, because there can be some other considerations about discrimination and relationship implications. So I'll talk about that a little bit more in a few minutes. And then again, genetic counselors can help try to provide some anticipatory guidance about how the genetic testing could impact you. If you, for example, if there's a lot of people with ALS in the family and you don't have any genetic variant and you're negative, some people might actually have what's known as survivor's guilt, and if they're negative, or they might feel guilty if they're positive, or it might change the family dynamics. again, these are individual. Some people might not have any guilt at all. It depends on the person, their family, and a lot of other factors. But these are things that we can think about to decide, all right, is this the right time? Do we want to do this or not do this? And there's no one size fits all for genetic testing or genetic counseling. Everybody is different. One thing I say often to patients in general is that we do not choose our genes, and we do not choose the genes that we pass on. And even this doesn't apply 100% because some people do choose the genes they pass on by doing assisted reproductive technology and something called pre-implantation genetic diagnosis, where you can actually prevent a gene from being passed down in the family. But usually that's already after having been passed down before we knew that we had it. So when if we don't do genetic testing, then we certainly don't know what genetic variants we might be passing down. And in general, this is not something, if we could choose not to pass something down, most of us would do that. So I try to say that because everybody has changes in their genes. I know I had 100 gene sequence, so I happen to know what mine are, but not everybody knows what they are. But we all have variants. We used to call them mutations, and it's just sort of the human condition. So why have genetic counseling and genetic testing for ALS? Again, it's individualized, and again, as I mentioned before, genetic counseling doesn't require that you get genetic testing at all. And it does provide access to expertise and empathy, and people who have done this before, who understand all of the things that can go into it. And again, we are always learning from our patients too. So we don't know everything, but we've done this before, so we can sort of try to help guide the decision-making process by asking the right questions, but really only each individual can answer it. But some of the reasons are to understand, more about when I mentioned the risks, benefits, and limitations, and finding out. Some people really want to find out if they have a change in their DNA that predisposes to ALS, not out of curiosity or family planning, but because there are now targeted therapeutics for targeted genetic therapeutics, and some of them are in clinical trials. Tofersen, as I'm sure many of you know, is FDA approved for patients with a variant in the SOD1 gene. And then we have our fusion trial for patients with a variant in the FUS gene, and there are other clinical trials. So if somebody's interested in enrolling in a clinical trial, then they'd have to have genetic testing to find out if they're eligible. The only thing that I would say is that most people actually who have a genetic change in the DNA have it in one of the genes that has a clinical trial or a therapy underway or available. So that's the good news. But some people will have a change in a gene that there's no clinical trial or intervention available for now. And some people will have a genetic form of ALS in a gene that does have a clinical trial or an approved therapy, but they might not be eligible for the clinical trial. The approved therapy, I think, is okay for everybody who has a SOD1 form of ALS. But if somebody is too far advanced, even if they have a change in their DNA, they might not be eligible for the clinical trial. So if that's the only reason, that's something, again, to discuss with a genetic counselor. If there are other reasons besides that, I think that's a very good reason personally, but just to know that it doesn't guarantee that you'll have access to a clinical trial if you do have a genetic form of ALS. But it also might help family members in case they might benefit from the information, because it's more informative to test the person who has the condition sometimes than the pre-symptomatic individuals, because sometimes there are changes in the DNA, and we don't know what they mean, and it helps to have clinical information to interpret that genetic change. And Some people, I talked about pre-implantation genetic diagnosis. Some people want genetic testing for family planning purposes or for life planning. They might want to know if they're at risk for a genetic form of ALS so they can decide, make life planning decisions. And some people believe that knowledge is power. They just want to know. And again, it's really so individualized. And it's also individualized in general about the timing to have genetic counseling, especially if you're not symptomatic. For people who aren't sure if they want to know or not, genetic test results, you can actually have genetic testing and then postpone finding out. So that's an option. And that's something you can talk about with a genetic counselor, but you might not want to get genetic testing at the time where if you're about to get married, or if there's something in your life that is just not a good, you're overwhelmed right now, it's not the right time. If you're pre-symptomatic, if you're symptomatic, I think the best time to get genetic counseling and possibly genetic testing is immediately, because I say wait is a 4-letter word when you have a progressive disease. If there's a clinical trial or an intervention that is available, the sooner you find out that it's genetic, the sooner you could potentially be eligible for an intervention or a clinical trial that could change the course of this condition. And for all neurogenetic conditions that I'm aware of in general, the earlier any intervention started, the better. It's usually easier to prevent and delay with the neurons than it is to reverse. And sometimes there's reversal, but again, the earlier any interventions are started, the better in most conditions, and especially in neurogenetic conditions. So the best time if you're symptomatic is at your first sign or symptom, and as soon as you suspect. But if you're already symptomatic, it doesn't mean that it's too late, because again, there are situations where it can delay progression. And so it's really, if you're symptomatic, to get it as soon as possible is my personal advice, unless you just have no interest whatsoever in any interventions and you don't want to know anything from your family. So again, these are individualized decisions that it's helpful to talk with somebody who has experience, like a genetic counselor. And again, the people who have no signs and symptoms, it's more complicated, because that idea of to know or to not to know has a bigger implication, because people who have ALS, you already know you have ALS, and it's really just to explain why and then have some options, hopefully. So before genetic counseling, is there anything that you want to think about to prepare? And I mentioned before that we really want to see medical records, lab tests, imaging, pathology, everything that you have, so that ideally in advance, so that the genetic counselor has time to review them. And we do look at the chart and everything in it to make sure that you're getting the best testing available. And then I mentioned also that if there's a relative that already had genetic testing, we want a copy of that genetic test report. That's really helpful. So the other thing that is helpful, if you can, is to talk with your family and ask them about their health, their medical history, and even other family members who passed away. We are going to ask questions about the family members' medical history, their age of death and cause of death, and things like that when we draw those family tree pictures. So gathering that information in advance can be helpful if you're going to have genetic counseling. If you have no symptoms of ALS, maybe you have a family member who has ALS, but you yourself don't have any signs or symptoms, it's strongly advised to secure any long-term care and life insurance before having a genetic counseling appointment, even certainly before genetic testing. And the genetic counselor will tell you that in pre-test, but ideally you want to have that in place even before there's anything in your record. So just to make sure that you don't because people, if you end up having a gene that we know causes ALS or even has an increased risk for developing ALS, you might need that long-term care insurance or life insurance. So if that's something that you would want to do that prior to genetic counseling and genetic testing, and then if you find out you're negative, you don't need it, okay, you can cancel it. There are laws that protect against genetic discrimination. We call it GINA, the Genetic Non-Discrimination Information Act. And this is applicable for employers. Large employers cannot discriminate based on genetic testing, and health insurance cannot discriminate based on genetic testing results. But if you work for a small company, I think it's under 50 people, or if you're in the military, there are exceptions, and it does not apply to life insurance or long-term care insurance, only regular health insurance. So that's why, we want to make sure that any of their possible risks, and that's a risk, that it's mitigated as much as we can, so that you can do the genetic testing if you decide to have it without having those risks and having just the benefits. Really, this is it's important. We want to try to do this to make things better, not to make life harder. And then the other thing to think about before you go for genetic counseling is if you want to have a support person or a family member with you at the appointment. And some people are private, they just don't really want to have a family member with them, and that's okay. But sometimes it's helpful because this is complicated information and it's emotional. And I know for myself, when I'm emotional, especially when you receive the genetic counseling at the results disclosure, sometimes I don't even hear what someone's saying because my mind's spinning because of something that's emotional. So it can help to have a support person, and people probably, a genetic counselor might recommend that you bring somebody with you if possible. So a little bit of detail, the pretest, there's different types of the genetic counseling that we do. The pretest genetic counseling, which is much of what I've been talking about to discuss, is this the right decision? And the first thing that we do is to talk about what we're going to talk about. So that's called contracting. And they say, what do you want to learn and what do you want to emphasize? And so you discuss, and the genetic counselor will say what she plans to talk about in the genetic counseling session. And then how you want the results to be disclosed. And then a lot of this I've already gone into about the medical and family history and the science, the risks and the benefits. And then really a lot more on that anticipatory guidance about an expected response to a negative or a positive or an inconclusive result. So there's sometimes a variant that we know is pathogenic, meaning it causes the condition. Absolutely 100% sometimes. Sometimes it can cause a condition, but it's not 100%. It's maybe 80% or 70%, or it just is increased above the general population, but it doesn't actually cause the condition. And there are other times there's a variant and we don't know what it means. So sometimes it might look like it would affect the protein and make it not work properly, but there's just not enough in the literature, and there are guidelines about how to interpret a variant if it's pathogenic or benign, or what we call a variant of unknown significance. So I think something that they talk about often in the pretest counseling is that the possibility of uncertainty. You might go through all of this and we still don't know exactly what the genetic testing results mean. So these are just important to discuss in advance, so that if it happens, you're not surprised and say, well, you thought you were going to get an answer and there's still no answer. We want to get an answer. And if whatever's known at the time, whatever science has uncovered, if it's known, you will find out whatever we can, but just to be prepared for any possible kind of result, negative, positive, or inconclusive. And then you'll also talk about who might see the results, who you'll show them to, and maybe how to communicate that information to other doctors, to family members, and if the genetic counselor can help with that. So then if you decide to have genetic counseling and genetic testing, then there's the results disclosure. And again, these can get complicated, so that's why it is good to have somebody with you if possible. Some genes can have more than one condition associated with it, so it's usually depending on where is the error in the gene, but you know, there are different things that can be learned from the same gene, different conditions, or again, you know, you might be told that it's highly likely but not definite that something will cause ALS or another condition. So and ideally, you know, part of what we do is when somebody has a positive result for a genetic condition is we help kind of adjust to that information, adjusting to the diagnosis, and helping provide resources for emotional support and for the psychosocial aspects of having a genetic diagnosis. I have to say that there's not enough of that. Genetic counselors do what they can do, but long-term therapy is just not in the scope of genetic counseling. But it's probably important to have emotional support and psychological support through this, because this is difficult information, and we need to do better at having resources for psychological and emotional support after genetic testing for people with genetic condition, especially some of these adult onset conditions. So that's something that we need to really work on as a community. But the genetic counselors will, in the post-test session, help think about some things that come up with that genetic diagnosis. And you know, one of the reasons that we don't like to test for adult onset conditions for young people is because sometimes having that genetic diagnosis can change how we feel about ourselves. It can change the way we think about ourselves, you know, shouldn't, right or wrong. It can. And I think, you know, hopefully the genetic counselor will talk about that, you know, we do all have something. We all have something in our genes, but just to adjust to that kind of new future or new outlook is something that genetic counselors can often help with, at least short term, if not, and maybe find support groups or options for longer term. And then again, risks to family members is a lot of what we talk about. So the genetic counselor will explain who else in the family would be at risk and what the risk of having a genetic change in the DNA is for them. And then we document everything. We provide it in a summary letter that you can have, so that you can go back to that and reflect on it, and that you can show that to other people to help communicate with them. I'm going to talk a little bit about genetic testing that's predictive for people who don't have any signs or symptoms yet. I'm not going to go into a lot of detail because I could talk for an hour on this alone. But if for most of ALS, which is dominant, there's a 50% risk of inheriting the variant for family members. And again, we don't usually do this for pediatric patients other than for maybe something like FUS ALS. There's other forms of ALS that affect young people, like ALS2, a few different genetic forms that can have a young onset. But in general, for predictive testing, we don't want to infringe on the autonomy of that child when they become an adult, and their privacy and their right not to know if they would so choose later. So there's something called the Huntington protocol that you might hear about for predictive testing. And that was because Huntington disease was a condition that is very, very well researched. It was one of the first adult onset neurological conditions to be characterized genetically. And so there was a lot of research into the benefits and potential risks of doing genetic testing pre-symptomatically for Huntington. But there are some things that are different about Huntington than ALS, and depending on the kind of ALS, Huntington has a much slower progression and a later age of onset, and you can actually predict the age of onset pretty well with Huntington disease, whereas it's not as easy to do with ALS. So not everything applies. The modified Huntington really requires 2 pre-test counseling sessions and neurological evaluation or psych evaluation. And I think these options are good to have, but they can be burdensome as well. And so the need for flexibility became very clear now we have telegenetic counseling, which is really helpful to, I think it's, again, it's individualized, and it's something that you talk about in the pretest about what kind of protocol you want to use for yourself. And there is flexibility, but there are also guidelines. So that's kind of nice. There's a plan from which one can deviate if it's helpful. And for pretest, for predictive genetic counseling, there's a lot of discussion about why you want to know and the emotional impact, and to offer time to opt out of genetic testing. That's why they had multiple pre-test genetic counseling sessions for the Huntington, because a lot of people would get the genetic testing and they said, well, you know what, I changed my mind, I don't want to know. And that's perfectly fine too, but people might want to have time to decide whether or not they want to go through this. And then there are other options like DNA banking, and it's also possible to do prenatal testing or pre-implantation genetic diagnosis without actually finding out your own results. So these are all things that can be discussed with a genetic counselor. I talked about the lack of support. There's a group called End the Legacy, and these are for genetic ALS carriers, and they are truly amazing. They were not happy with the way things were going because their predictive genetic testing for ALS, there's a famous geneticist named Wendy Chung, and she says, we don't like diagnose and adios. And I think there was too much diagnose and adios. Here's your genetic information. There's no guidelines. There's no recommendations following the results. And so what do you do? So this organization really has come together to help to create guidelines to what monitoring should be done if you're a carrier and you're pre-symptomatic, to have research for pre-symptomatic carriers, to develop biomarkers, and they are talking with the FDA. And they also have a support network, a support group for psychological and emotional support services that are much needed for people who are predisposed to have ALS, who have a genetic form, and they're succeeding. So this is actually adapted from the End the Legacy website, and these are many of the clinical trials, some observational, some interventional for ALS for people who have a gene, whether or not they have any symptoms. So I'm going to just quickly talk a little bit about our sponsored genetic testing and genetic counseling program. And again, we have sponsored genetic counseling. This is telegenetic counseling, and the most common genes are, fortunately, 4 out of 5 of them have either a therapy available or a clinical trial in development for a gene-targeted therapeutic intervention. And about more than 75% of patients who have a genetic form of ALS have a variant in one of these genes, that in one of the 4 genes that has an intervention or a clinical trial underway. So that is another reason why people might really want to have genetic testing. But again, I recommend discussing it all with a genetic counselor first. So for our sponsored genetic testing program, anybody who has ALS or is suspected of having ALS at any age is eligible for sponsored genetic testing, which is no cost to the patient. And for people who have no symptoms but have a family history of ALS, anybody who is 18 or older is eligible for sponsored genetic testing with our program. And again, these are our guidelines. There are exceptions and there's flexibility. And if a genetic counselor has a reason why this should be done for a patient who's not 18, this is not, it's not carved in stone, but in general, that's our guideline. We don't do the predictive testing for patients who are until they're adults. But if somebody has a family member with ALS, they're eligible for predictive testing, even if that genetic variant there's no genetic variant that was found in the family member, if they haven't had testing. If they had testing and there was no variant found, then it doesn't really make a lot of sense to have genetic testing for family members. But if no genetic testing was done and you have a family member with ALS, then you're eligible for genetic counseling and genetic testing through our sponsored program. And again, Genetic counseling is not required. It's strongly encouraged. Most people have genetic counseling locally. We provide genetic counseling through Gene Matters, which is a genomedical company. That's the parent company. And this is sponsored genetic counseling. And this is telegenetic counseling. So they don't have a neurological evaluation in a hospital. They might not be able to go through the records the same way. So the ideal world is see a genetic counselor locally. You can have a face-to-face relationship. I like that the best, but the Gene Matters genetic counselors are wonderful. They're knowledgeable, they're experienced, and they are available through telemed. And that can be really an advantage, especially if somebody has difficulty with ambulation or just getting to a hospital is not really practical. You can have the genetic counseling remotely. And these are the genes on the panel, which this is done through Prevention Genetics, which is a clinical genetic testing laboratory, not research testing. And the genes on the panel are chosen by this expert gene curation panel. And the lab director of Prevention Genetics is on this curation panel. And so are some of my genetic counseling colleagues. So there's reasons why certain genes are included and not included. And this is an evolving list of genes, but it's not fully 100% comprehensive. So again, the genetic counselor will talk to you about that. And if you choose to have genetic counseling through Ionis's sponsored genetic testing program, when the doctor orders genetic testing, they can click a box. And again, you can opt out of the testing in advance, and they can check a box for only post-test or for pre-test and post-test. I recommend both. Sometimes pre-test genetic counseling is not available in person in some of the large ALS centers. They just don't have enough genetic counselors to do both pre-test and post-test, so they only offer post-test. But in that situation, you might choose to do the telemedicine genetic counseling through our sponsored genetic counseling program through Gene Matters. Or if you just want to have the genetic counseling and you really don't think you're going to get the genetic counseling, or you're not sure at all, you can call the 888 number. This is 888-460-1891. And I'm going to put that at the very end of the talk so that you can call and learn more about genetic counseling for ALS and schedule an appointment for genetic counseling through our sponsored program. I'm just going to quickly mention about the results because it's sponsored. We do get results, but we only get the variant information. We get the gene and the variant. We get the age of testing, the age of onset, and if it's limb or if it's bulbar, we don't have any patient information. We don't get any address, phone number, name, date of birth, nothing that could be identifying. We don't want it. We don't receive it. But we do get the variant data for Ionis, and we get that because we want to learn more. What does this mean? How what can we learn from it? We do want to share this with other researchers, and so that we can learn the most we can about ALS genetics and the causes, but again, nothing about no individual patient information, and we don't get any information from the genetic counseling session. The only information we get is how many patients had genetic counseling because we have to pay them, but we don't receive any information about that. And I just want to say thanks to Prevention Genetics for doing the testing, Gene Matters genetic counselors, my team at Ionis, Amy Shea, who is the Director of Diagnostics and Strategic Initiatives at Ionis, who really built this program from scratch, and especially the ALS patients and carriers and the ALS patient community who are a reason for everything. These are some resources, the Gene Matters phone number if you want to make an appointment for sponsored telegenetic counseling, the NSGC, if you want to find somebody in person, you can find a genetic counselor and look for a neurogenetic counselor. And the Legacy, they actually have a support group on the third Wednesday of every month at 7 p.m. And actually it's a carrier for she gave me permission, Lindy, who is going to be holding these support groups. She is a carrier for a gene that predisposes to ALS or FTD, and this is the last resource is the ALS Research Collaborative, which is an amazing patient volunteer registry for ALS by the ALS Therapy Development Institute, TDI, and that's their website. And they're doing amazing work they do genetic testing, but on a research basis, so they don't have genetic counseling. and they really are wonderful researchers. They get lots of information about clinical presentation, about diet, about environment, and about genetics, and they get biospecimens, and I think they're wonderful. So I just wanted to say that that's another group that we want to work with and collaborate with and learn as much as we can. And with that, I will end this talk on genetic counseling and take any questions that anybody may have.
Thanks so much, Ms. Bernstein. That was an incredible amount of information. We particularly appreciate you kind of starting off by providing an overview of genes and how they work and how they're passed along. That's quite helpful. There are a couple of questions that have come across my desk. We're a little late on time, but let's see if we can answer a few of these questions. First off, if a parent passed away with ALS without having genetic testing, should their children get tested?
Their children can be tested, absolutely. Should is something, again, it's individualized, but it should be offered to their children, yes.
Great, thanks so much. Again, should and would, probably definitive terms there, but it's good to know that children of people that have already passed away without having genetic testing at least have that opportunity. Another quick question, this relates to privacy, I believe. If I get tested, will my children have access to the information, or am I the only one that can share that with them?
You are the only one that can share that. Actually, genetic counselors do not disclose any genetic information without written consent of the patient. So that's why I actually wrote to the person who's doing that and the legacy support group. And I said, is it okay if I say that you're a carrier or not? And she said, absolutely, I'm happy to share that information. But we don't share information unless somebody has written down, you may share this information, and with whom. We don't even share it with other physicians unless the patient has given us written permission. So we will not share that with your children, with any children, without the permission of the parent. I think that's different if the parent is deceased, though. So that's when obviously you can't have permission. So that's the only exception. But no, we don't give information to anybody without written permission.
Privacy is so important. Another quick question here. If interested, what is the starting point? My neurologist? So where does someone start? Is it the ALS clinic neurologist?
Well, if it's for diagnosis in general for ALS, the neurologist. If it's the genetics, you can do it through the neurologist. They can order the testing and they can order the genetic counseling. Or if you don't want to talk to your doctor about it, you can call, if you want to, you can either call the Gene Matters and do the telegenetic counseling with that 888 number, or you can go to the National Society of Genetic Counselors website and click on Find a Genetic Counselor. Usually a lot of genetic counselors will want a doctor's referral, but some genetic counselors understand that really you might want to just talk to a genetic counselor and not to a doctor. But so all three are possible. I think it's important to get a neurological evaluation though, because we want to make sure that it's truly ALS and that you're getting the best care, medical care.
So to clarify, you may reach out to your neurologist and they would provide you with a referral or a doctor's order, or you have the option of reaching out for genetic counseling on your own if you prefer to go that route. Is that correct?
That's exactly correct.
Wonderful to have those different options. Another question I think you answered. My husband has ALS and does not want genetic testing, but 2 of our 3 children want genetic testing. Is this possible?
Yes, this is possible. This is tricky. And this I highly recommend a lot of pretest genetic counseling, because if the person who has ALS doesn't want to know, if the children find out that they're carriers, that would automatically show that the father has it. So that's a very complicated family situation. And that's why genetic counseling is a really good idea to talk about that, because then the children are going to have to decide, do we not tell the father? Do we know something that he doesn't know? And how is that going to affect the relationship? So I would strongly recommend seeing a genetic counselor and getting into the details of your family and your relationship and decide the best course of action. But yes, it is possible.
Well, I can certainly see how incredibly valuable genetic testing is, certainly in certain situations like this situation. Another question, and thank you. We're going just a minute or two over, but I don't want to have these folks not have questions answered. If I have ALS genetic testing, will any other genetic diseases show up, like cancer or Huntington's disease?
Yeah, so that depends. Huntington, probably not. You really need a specialized test for Huntington disease, but on this panel, no. This panel is only looking at ALS genes. You can have something that can look at other genes if you know, there are reasons that you might want to look at other genes, but for this panel, it will really only look at these ALS genes, but it could tell you about frontotemporal dementia as well. So that's something that, again, is why it's good to have pre-test genetic counseling. So some of the genes that are on the ALS panel do not cause frontotemporal dementia. Some of them cause ALS or FTD, and some of them can cause both. So those are things that's another reason why you really want to have that pre-test genetic counseling session, so you know exactly what information you're going to find out.
Great. And it sounds like pre-testing is so incredibly valuable to have that information before you make a decision about testing. Another quick question. If my children have an ALS gene, will they eventually get ALS?
Yeah, so that depends on which gene and which variant. So in some cases, yes, absolutely. Eventually 100% they will, if they don't die of something else earlier, which, you know, that's always a possibility. But yes, some genetic variants are 100% informative and predictive. Some of them just lead to increased risk. Some genes really, you might know that you're going to develop ALS, but you might not know when. So that's when the monitoring becomes important. So again, it's complicated information. So there are definitely some genes that have an increased risk, but do not necessarily cause ALS, and others that are causative.
Great. A lot to learn. And I am going to close with actually not a question, but a comment that was submitted. And this is a great comment to close with. I had genetic testing so I could get into the best clinical trial for me. So that was somebody that just shared their positive experience with genetic testing, allowed them to get into best clinical trial. Ms. Bernstein, I really appreciate your time this afternoon. I know it was a lot of information to cover. I'll let people know again that this entire presentation was recorded and will be posted to the ALS Association website along with the associated slide deck. And please join us for a quick 3-minute survey that will appear immediately after the close of the webinar. Thank you so much, and I wish everyone a safe and enjoyable afternoon. Take care.
Thank you for listening. Okay, bye-bye.